صحيح. بس يعني يمكن لو تيجي أحسن. لا يعني أجيبه عن هيك بعدين. يعني مو نكمل والله هاي فرع هيك. فهو تراي. أنا ما أدري تفكر شو أسوي بس يعني الهدف التسجيل زين. Stop. Our session today is about the subject of mediastinum. And as we usually did, we will start with the plastic model and then transferring the demonstration to a cadaveric sample. In this plastic model, I will discuss and explain the structures in the mediastinum in a term of individual description. I mean that I will not say that the level of sternal angle is separating the superior from inferior mediastinum. I will not say that the inferior mediastinum is the pericardium, which is the middle of inferior, and the anterior to it is the interior of inferior, and behind it is the posterior. I'll discuss structures in the mediastinum in terms of individual structures according to what was described in the lecture. So, what could I see here? I can see here a vessel, because it is a plastic model, it is clearly seen as a vein, and it is a big vein. And it is on the right side of another vessel, which is an artery. And both these vessels are above to the heart. And third to them is this vessel, which is also a vein. These three vessels, the mid one is the ascending aorta. As you can see, I'm discussing things in a practical way. And on the right side of the ascending aorta, this is the superior vena cava. Well, on the left side of it, this is the pulmonary trunk, which is pulmonary artery. In spite of it is an artery, it is colored in the sample blue because this pulmonary artery transfers the deoxygenated blood from the right atrium to the lung. And that's why it is a pulmonary artery, because it is out of the right ventricle, but it is blue color because it's called the deoxygenated blood. So the three vessels seen just above to the heart. The middle one is the ascending aorta. On the right side of it is the superior vena cava. On the left side of it is the pulmonary trunk. And from that, I will pass to other structures. For example, the superior vena cava will lead you to the brachiocephalic vein. This is the left brachiocephalic vein, which is long and oblique. And this is the right brachiocephalic vein, which is short and semi-vertical. And these brachiocephalic veins are formed by union of internal jugular vein and subclavian vein. This is also the left internal jugular, and this is the left subclavian uniting here. And the union of the internal jugular and subclavian is at a point which is the sternoclavicular point behind the sternoclavicular joint on right and left side. Both the brachiocephalic vein unite at this point, which is behind the first right costal cartilage at the right border of the sternum, forming the superior vena cava. The upper half of superior vena cava around there is outside the pericardium, and at this level, which is level of the second rib, it enters into the pericardium to be a content of the middle of inferior mediastinum. The relation of brachiocephalic veins, right and left, include the thymus, which will not be seen neither in the plastic sample or in the cadaveric sample, because it is a flattened organ that becomes smaller in adult, and most of the cadavers are adult cadavers. And anterior to the thymus are the manubrium of the sternum, right? While behind the brachiocephalic veins are the branches of arch of the aorta. This is one of them, this is the other, and that's the other. What are the branches of arch of the aorta that are behind the brachiocephalic vein? First, we have to look to the arch. As I said, this is ascending aorta, superior vena cava, pulmonary trunk. The ascending aorta arches backward to form the arch of aorta, although it is here separated in the plastic sample, but it is an complete arch. And this arch, as you can see, I'm seeing you from the left side, is an arch from anterior to posterior, and thus the branches could be described as branches, first one anterior, next to it, and the third. The first one, which is this one, branch of arch of aorta, which is brachiocephalic trunk, right brachiocephalic trunk, that divides into right common carotid and right subclavian artery. The next is the left common carotid artery, and the most posterior is the left subclavian artery. These three branches of arch of aorta are behind the brachiocephalic vein. Next, I can see the pulmonary trunk divided into right and left pulmonary arteries. I can see the root of the right lung, and behind it, this is the two pulmonary veins conveying the oxygenated blood to the this is the pulmonary veins, conveying the blood from the lung to the left atrium, and behind them, these are the bronchi. These are the secondary bronchi. So you can see that the arch of the aorta is arching above the root of the lung. And possibly, if that was a cadaver, we may see a ligament between the left pulmonary artery and the arch, which is here, ligamentum arteriosum. But in this plastic sample, it is not represented. Neither the phrenic nerve or the vagus nerve are represented in this plastic model. What is next that could I see in the sample? Of course, I may see here some of the tributaries of the brachiocephalic vein, but I will neglect them because they will be considered with the head and neck at the root of the neck. But I will pass from the arch of the aorta backward into the descending thoracic aorta, which is this one. The descending thoracic aorta is the content of the posterior mediastinum. It is on the left side of the oesophagus, but inferiorly the oesophagus becomes in front of the descending aorta. So be aware that the lower part of the descending thoracic aorta shows the oesophagus in front of it, All other parts of the descending aorta are to the left side of the esophagus, except the lower part of the descending aorta, which is behind the esophagus, because the esophagus deviates to the left in its lower part. I may see here also مؤشر هذا الكي يلا اكو شيء طويل شيء قلم مثلا قلم منطق ما في قصير توسخ متوسخ ولا yeah okay. So as you can see, this is the descending thoracic aorta and its lower part. So as you can see, this is the descending thoracic aorta. It is on the left side of the esophagus, which is not seen here, but you can see below that the esophagus turned to the left to become anterior to the descending thoracic aorta. Other structures that could be seen here is the sympathetic chain. This is the sympathetic chain. It contains many swellings, which are the ganglia of sympathetic chain. And all the ganglia of the sympathetic chain are connected by branches from its lateral side, which are rami communicantes. The rami communicantes are either white or gray, connected with the nerves, the intercostal nerves and the van bundle. So the lateral branches of the ganglia of the sympathetic chain are the rami communicantes, while the medial branches are the splanchnic nerves, which are down to the abdomen. And I explained that in the lecture. And next to the sympathetic chain on the medial side of it, this is the hemiazygous vein. And above it, this is the accessory hemiazygous vein. Of course, this is blue color is for the vertebra. I don't want to say something about the heart because it was considered in the previous class. But I will pass to the mediastinum on the right side. That was the mediastinum on the left side. And this is it. This is the mediastinum on the right side. Here, I will see also the superior vena cava, brachial cephalic vein. But behind the superior vena cava, this is the trachea. And behind the trachea, this is the esophagus. And the esophagus is descending behind the root of the lung. This is the root of the lung. This is the carina. Possibly, if the sample was more accurate, you will see a nerve on the vagus nerve, a nerve on the trachea, and a nerve on the superior vena cava. But the sample did not demonstrate that. The nerve which possibly seen on the trachea is the vagus, or the nerve seen on the superior vena cava is the phrenic nerve. Again, I will see the sympathetic chain with ganglia and branches from the lateral side of the ganglia to the intercostal nerves, which are rami communicantes, while branches on the medial side of the chain, which are splanchnic nerves. And this is azygous vein. And just look to the blue color structure here on the side of the azygous. This is the thoracic lymph duct. This is the thoracic lymph duct coming from the abdomen and ascending up. So, if I remove the heart in this sample, of course, I don't need to say this is a diaphragm, please, this is central tendon of diaphragm. I will remove the heart. Having another view to the mediastinum. This is the trachea, showing the tracheal link. This is the carina, the main bronchi, and then secondary bronchi. Of course, the first division is the main bronchus. You can see how the right main bronchus is in the same line of the trachea. It is less oblique than the left bronchus. That's why foreign body may pass to the right bronchus. And behind the trachea, this is the oesophagus. See how that the oesophagus is always on the left side, on the right side of the descending thoracic aorta. Except inferiorly, the oesophagus is deviated to the left to become anterior, not on the right side of the oesophagus, of the descending aorta. The descending aorta is on the left side of the oesophagus, except the lower part of the descending aorta is behind the oesophagus. You can see the thoracic lymph duct, the azygos vein on that side. Sympathetic chain. I will remove these pieces also. To see the complete course of the thoracic lymph duct. See how that the thoracic lymph duct runs on the left side of the azygos vein, but at the level of sternal angle of Lewis, the thoracic lymph duct deviates to the left side. You can see the deviation of the thoracic lymph duct at the level of sternal angle of Lewis to be adjacent to the aorta or behind the aorta on the left side. That's all about in this plastic sample. And now we will try to see what could be seen on cadaveric sample. First, let me return things to its position in order that you can examine them. Thank you. Nobody say that the cadaver will show you all these structures. I'm sure that the cadaver is much difficult for me and even for you. But if you follow the order that I was describing, you will not miss structures. Because I think I did my best to explain it. This is the pericardium, and this is the diaphragm. This is the liver, and that is the head. So I'm looking now to the pericardium, and this is the abdomen, this is the diaphragm, right? And just above the heart and pericardium, I will see three vessels. 1, 2, 3, just like in the plastic model. The middle one is the ascending aorta. On the right of it, this is superior vena cava. While on the left side of it, this is the pulmonary trunk. Right? This is it. Right? And the ascending aorta is followed by the arch, which gives the branches. These are the branches. And that is the brachiocephalic vein that may be forming the superior vena cava, but it is cut in here, damaged. Right? You can see that the superior vena cava begins here by union of the this internal jugular vein, this brachiocephalic vein. This is the left brachiocephalic vein, and that is the right brachiocephalic vein. Left brachio and right brachiocephalic form superior vena cava, and this is the level of the first right costal cartilage behind the border of the sternum. From here to the level of the second costal cartilage, the superior vena cava is outside the pericardium, and next the superior vena cava is inside the pericardium, as you can see. Right? Behind the superior vena cava, you may see I will deviate the superior vena cava. Behind it, you may see the trachea. And behind the trachea, you may see the oesophagus. Right? And maybe if we have a little light there, we may see the sympathetic chain here with the medial and lateral branches. You can look to it by yourself, the rami communicantis and the splenic nerves. Going to the other side, again, this is the ascending aorta, this is the pulmonary trunk, superior cava. The ascending aorta turn backward to form the arch of aorta, and these are the branches of arch of the aorta. This is the left subclavian, left carotid and subclavian. After that, the arch deviates downward to form the descending aorta. Descending aorta is on the left side of the esophagus, except inferiorly, the esophagus deviates to be in front of the descending thoracic aorta. Of course, you may see a trace of the hemiazygos and azygos vein, and you can see a trace of the sympathetic chain because this is a cadaver. It is impossible to be clear just like to the plastic model. I believe that new teaching of anatomy regarding the mediastinum should be on imaging, but fortunately you have in the fifth year a course for radiology, and they will teach you all of these in imaging. The relations have been discussed in the lecture regarding sectional anatomy in CT scan and MRI. You have to see only these structures and relations that I have just described. Thank you. احنا نتمجد لا نتمجهن يعني ولو من قصد وزن قصة